Good morning. My name is David McIntosh, and it's my pleasure to welcome you to this media briefing for the 12th edition of the City Health International Conference. The reason I'm starting off the media briefing and doing this really is because I'm involved in the first City Health Conference, which was held back in 2012 in the City of London, where I was working at the time. And the origins of City Health International really were in a recognition that a lot of the problems, complex problems faced around health, particularly in urban settings, required multiple agencies to come together. And my background is in drugs and alcohol work. And we used to hold lots and lots of conferences where we all spoke to people who did almost exactly the same job as we did, which was sometimes very interesting, but often not that great in advancing new ideas. So with City Health, we wanted to hear from people who worked in other areas, but also dealing with the same problems in other areas in terms of both professional disciplines, but also people working in other cities and other countries. I couldn't imagine when we started City Health in 2012 that not only would we manage to have 12 editions of the conference, and that we would have to deal with a pandemic, but I never imagined in my wildest dreams that one day we would be running a conference in Bishkek, and it is a real delight to be here and be meeting lots of new people for the first time, but still wanting to look at how we tackle complex health issues in their broad context, still looking at the power of partnerships and still appreciating the opportunity to listen, share experiences and learn from each other. So we have a 2-day conference ahead of us, but I know, this is primarily a media briefing opportunity. I'm joined here by 3 representatives of agencies that have helped make City Health International 2023 possible. And I'm now going to pass over to these to say a few words about this conference and the next 2 days and the opportunity we hope it provides. Now, first off, and I just think I'll work across to my left, I would like to introduce Professor Heino Stover, who has a long and distinguished career in harm reduction and has been, heavily involved in leading the SOLID project. Heino.
So many thanks, David, for the kind introduction. Dobruta. My name is Heino Stover. I'm a professor for social scientific addiction research in Frankfurt in Germany at the Frankfurt University of Applied Sciences. And I'm representing a research project here, which is called SOLID, Social Work and Strengthening NGOs in Development Cooperation to Treat Drug Addiction. So a long title. The aim of this project is that we get together early career researchers to collaborate and to work out on certain topics which are perfectly in line with the City Health Conference topics. That means social work and drug treatment, social work and infectious diseases, and social work and prison. And this is why we are here with the students and my colleagues and the postdocs. So you will see us during the conference. My colleague Ulla Pape will present a common book we edited. It will be launched during the City Health Conference on on the topic of social work in prison in the 5 countries. And the 5 countries are Uzbekistan, China, the Medical University of Shanghai, then Germany with Frankfurt, Kazakhstan with Astana, and the last one is Kyrgyzstan with the Bishkek State University. So we have been received by the dean and the director of the Bishkek State University on Tuesday, several researchers from Kyrgyzstan are here and will take part in the conference. And so we are contributing to the conference with our topics, which we can elaborate much more during this conference. I've been to several conferences of the City Health Conference. David McIntosh has been organized. And okay, thanks a lot. David McIntosh has been organized, and it is the attempt to tackle the problems we do have in all of our cities, which should be tackled together, and we should find common solutions to these challenges in the health and social area. And mainly this is drug use in several forms, whether it is opiates or whether it is tobacco smoking, and it is alcohol drinking. And we definitely had, when I look back to most recent conferences, several solutions we talked about on the City Health Conference. So many thanks for the invitation. I'm looking forward to a very vivid 2 days conference, and we will bring in our expertise into the City Health Conference. Many thanks.
Thank you, Heino. I'd now like to invite one of our local partners and one of the people who's helped make the conference possible to speak. So if I could invite Alfaya Aldarovna Samogoralna from the Bishkek International Medical Institute to say a few words.
Good morning. Good morning, dear participants and media representatives. So first of all, I would like to extend my gratitude. This City Health Conference accepted our application and selected Kyrgyzstan to host the 12th International Conference. For this, we would like to extend our great thanks to them. Secondly, I would like to acknowledge the input of our Kazakh colleagues and experts, which agreed to take part at this conference and attend us in Kyrgyzstan. This conference is extremely important because the experience accumulated by experts dealing with non-communicable diseases is very critical in the context of Kyrgyzstan. Unfortunately, the mortality rate globally remains quite high because of NCD, and 41 million people, 71% of the total number of deaths is because of non-communicable diseases. All health systems of different countries in the world are spending huge amounts of money and funds to treat the chronic diseases. What is the challenge? These chronic diseases, non-communicable diseases, cardiovascular diseases, the respiratory diseases, and cancer, diabetes mellitus, and other diseases lead to early mortality. They don't commence in acute form. They emerge very slowly and in a chronic as part of the chronic pattern. And secondly, our citizens have low mobility, and they are well aware of all risk factors. They don't practice the health saving practice attitude towards their health, and all the health promotion activities don't result in positive impact. Kyrgyzstan is ranked the fourth among 187 countries in terms of consumption of salt. 50% of people, of men in the country consume alcohol, and 27% of women consume alcohol, use alcohol, and a high percentage of smokers. All these risk factors result in losing the working abilities among the population, and therefore today's conference is highly important and crucial. Bishkek International Institute conducted several scientific researches and studies and surveys among the students of Bishkek universities, and we have found out the risk factors, the main risk factors, and all these figures testify to the fact that the young people don't reflect on about their health in 20 years from now on, and don't lead healthy lifestyles. And this meeting of experts which accumulated positive experiences, and they received very good reviews, positive reviews, and we are looking forward to sharing our knowledge and practices and experiences and lessons learned. I think for the Central Asian countries it will be highly beneficial, and we are ready and committed to respond to all the questions of the journalists. Thank you.
Thank you very much. And I'd now like to invite another one of our local hosts, Dr. Bakit Nyazevkovna Chumanova from the National Association for Harm Reduction of Human Health Risk Factors, to say a few words.
Good morning. Good morning. I'm very much thankful that I was among the invited guests to this international conference. This conference is highly important and very needed. As my colleague Alfia Eldaran mentioned, the same problems are experienced in Kazakhstan. The health problems are highlighted as the problems of the well-being, and this is our main goal in terms of sustainable development goals. Every person is willing to live long life of high quality, and it depends on the health of the person. And Kazakhstan has survived the pandemic. These are new threats, new challenges, which are emerging very rapidly by the third millennium. The global science has developed lots of innovations and approaches, and today we have to decide what needs to be revised and to be changed, and the world is becoming mutually mobile, mutually connected, and mutually related, and the pandemic showed this, and it showed the non-preparedness of the health care system. In many countries, we have lost many lives, many patients who were infected with coronavirus, and it showed many problems which exist among the young people and adults, and severe cases of the pandemic, and there are many unaddressed issues related to this coronavirus. We can see that severe cases emerged in those patients which had diseases, respiratory diseases, and overweight, obesity, and diabetes mellitus, and young people were sick with coronavirus, and they had the unidentified diabetes mellitus or sugar diabetes, and the health professionals are calling upon for health screenings. And today is not a secret that our patients are blaming the health workers for being unhealthy, and but at the same time 80% of the health of the human being depends on health workers, 20% on genetics, and 20% on the environment and what is happening in terms of the environment globally. We cannot stop the processes which are taking place in the air, in the soil, in the water, the climate change, and climate warming, and so on. There are too many of them, and we are not able even to suspend the devastating effects of these environmental changes. 52% depends on the lifestyle of the human being, and the lifestyle is not perceived in a common way by all people. The group of health workers, scholars, scientists, and public associations, we started reviewing the non-communicable diseases which cause which is a risk factor: tobacco smoking, nutrition, and alcohol consumption, and low mobility and less exercising. And we continue these efforts together with the government agencies. Today at this conference, we have the big, large group of our experts, maybe compared to other delegations, and I'm very happy that we've been invited to take part at this conference. Globally, things are happening so rapidly, and we have to synchronize our watches and our agendas and to address some cross-cutting issues. And we have to come up with the unified common approaches and solutions. What happens in Kazakhstan, for example, the emergence of some diseases, some non-communicable or infectious diseases. In some days it can emerge in Bishkek, and in some days in other countries. And WHO, World Health Organization, they have revised the protocols of treatment during the coronavirus pandemic. There were lots of achievements. There are new challenges. The cities are undergoing urbanization in Central Asia, and therefore it is important for the Central Asian countries, these countries which are developing and they are gaining ground in terms of their development. And it is very important and critical to meet with such scholars and scientists from the developed countries and states. And today it is a good opportunity for us to exchange some ideas and opinions to contribute to the health of our nations. Thank you.
Thank you very much for that excellent outline of why events like today matter. I'd also like to invite the Dean of Faculty from the Bishkek State University to come and say a few words.
Good day. I represent the Association of Social Workers of Kyrgyzstan as the president of this association, and Bishkek, Kyrgyz State Institution, where we train Bishkek Humanities University, which issues social workers and psychologists involved in this sector, and we are grateful to the organizers of this event and to the partners for the first time. It is being organized in the Central Asian region, which is a distinctive feature of this event. And I would like to highlight, first of all, that the human factor is everything. And therefore, we should be focused, first of all, on the correct selection of the staff, of human resources. And we have the public health faculty at our university. And I have reviewed the curriculum plans and the working plans of those faculties, and unfortunately I found only few disciplines related to the social and psychological issues, and therefore medical and social work, when it is united, it is the most efficient, it is the most demanded direction to deal with the drug use, with alcohol abuse and tobacco smoking. And in that field of activities, Association of the University works with Frankfurt University closely. We are having our graduates enrolled in the PhD programs at Frankfurt University, and we are expecting them to come back to enhance our faculty staff, but also the expertise that we have in the country in the areas of the control of drug use, alcohol abuse, and tobacco smoking. So we are very grateful to Professor Stoffer from Frankfurt University for the fact that at the end of this month, so 5 specialists have been selected from the Ministry of Social Protection. So from the Department of Social Protection and Social Services, 3 specialists, 2 master's degree students, and 2 another students are planning to visit Frankfurt University to have studies in this field. So today's event should be highlighting the importance of this specialty and the importance of having more of such expertise in the country. They become critical for the prison reform, and we are working right now with the probation service, with the penal enforcement agency as well. Here we will have the representatives from the state and this is a problem which is not of local scale, but it is rather of the global scale, I believe, and the fact that we are here together, we found the time to be here. This highlights the significance of the agenda.
Thank you very much. And I think that was an excellent reminder from all of the speakers, all of our hosts, about the fact that this conference is looking at some of the biggest challenges that all countries and cities face in terms of improving health of their populations. We now have a little over 15 minutes for any questions that people may have. So it's now an opportunity for you in the audience to ask a little bit more about the conference and our thoughts. So over to you. If not, you may get a chance for a coffee before the conference starts at 10 o'clock. Maybe we should have a prize for the first question. No questions? Oh, there's a call for no questions. Okay, well, in the absence of any questions, thank you all very much for coming along to this media briefing. And I look forward to seeing everyone back here at 10 o'clock for the start of the conference proper. Many thanks.